Dr. Bondarev, you have talked about how, the machines cannot really be trusted. So, still when it comes to manual adjustments and stuff, it's with the hands, it's an art, is where it's at. And it makes a lot of sense to me. However, there are machines out there, and I want you to give me a comment on one particular machine which lots of people are searching for these days, patients I'm talking about, and it's hyped, advertised, and maybe it's good, maybe it's semi-good, I don't know. It's the traction machine, the one which pulls you apart like a couple horses, and there you are. Give me your viewpoint on those on that particular machine, please.
In the previous interview, we talked about Russian roulette. Again, I'm Russian and I'm proud of having that roulette in our culture. But I do not suggest that people play this game. Again, with this kind of machine, I've seen results when people get well, and I've seen results when people get so bad after it that even lengthy conservative therapy could not help them, and people got under the knife of the surgeon. Let's say a machine performs certain procedure without knowing whether it's good for a patient or bad for a patient. Let's say a patient has little protrusion, and machines start flexing, destructing, and so forth. This protrusion may get into the disc and get into its proper place, and then we all applaud, everything is great. What if instead of that, this little protrusion goes to the opposite direction, and the nucleus, the substance inside of the disc, goes out? Then we get so-called herniation or prolapse, or there are many terms, extrusion, and so forth. That leads patient to a state of such terrible condition that I've seen even compression of the nerves. We call it Kodak-Weiner syndrome after this kind of mechanical device. Maybe mechanical devices work in other medical fields. I don't know. I am not an expert in that. But mechanical devices that people use in our field, it's a Russian roulette. You can get wonderful result, you can get terrible result, and I do not feel that is moral, professional, and ethical to play with somebody's health, with somebody's spine, with somebody's life. We do have traction techniques, we have tables, but again, it's a manual traction. When you have biofeedback between you and the spine, between you and the body, and then you know what's going on. If the body reacts in inappropriate way, you know about it right away, and you can stop it. When it comes to the machine, it's totally different ballgame. You probably heard about ancient Latin principle that was promoted and proclaimed by Hippocrates, non nocere, which means do not harm. Our major goal is not to harm the patient. If we can help patient, it's great, but we definitely cannot make him worse. That's why my take on it is absolutely definite. I'm completely against any machinery. I'm not talking about these primitive additional services like electric stimulation, ultrasound, these kind of things. I'm talking about something significant like traction machine. I'm completely against it because it's very, very dangerous. That's pretty much my take on it.
Thank you very much.